In this video, we are going to talk about a layman's guide to the US healthcare system. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Have you ever found yourself curious about the topic of a dispute over healthcare? Or why your health and accident insurance operates in the manner that it does? The healthcare system in the United States can be challenging to comprehend, and even the term system can be misleading due to the fact that different aspects of it are managed by hundreds of separate organizations. These organizations include the federal government as well as nonprofit and for-profit businesses. Financing. The United States of America spends more money than any other country on healthcare services. On average, they spend more than twice as much per person as the other nations who are members of the OECD. These costs are covered by a convoluted combination of public payers, including the federal, state, and local governments, commercial insurance, and individual payments. There is not one health insurance program that covers the entire country. Employers in the United States of America are primarily responsible for voluntarily providing health insurance coverage to their workers and the dependents of those workers. The scope of government programs is limited to those who are elderly, disabled, or among the poor. Each of these private and public health insurance schemes offers a unique set of benefits, as well as a unique combination of funding mechanisms and reimbursement rates for medical care providers. There is a lack of coordination between public and commercial programs. This results in some individuals having access to both public and private insurance while others have neither. Despite this, individuals who do not have health insurance still have access to some form of medical care. Organization. A delivery system that is only loosely structured and is organized at the local level is responsible for providing medical services. It is up to the community's resources, desires, and the free market for hospital services to determine whether or not a hospital should remain open or close its doors. In addition, medical practitioners are allowed to establish their practices in any location of their choosing. At the federal level, there is no health planning. The planning efforts at the state level range from none to strict review of hospital and nursing facility construction projects. Programs financed by the federal government and state governments provide some primary care to people that would not otherwise be serviced by the fee-for-service (FFS) system in locations where there are insufficient private providers, such as inner cities and distant rural areas. The municipal and county public health departments are responsible for the regulation of sanitation, water supply, and environmental dangers. These departments also run public health clinics, which offer a limited range of primary care services. Different kinds of insurance. The majority of people in the United States obtain their health coverage through their place of employment. This type of health coverage, known as employer-sponsored health insurance, is also considered to be private health insurance. In addition to coverage provided by employers, there is also healthcare provided by the government in the form of Medicare, for seniors, and Medicaid, for lower-income individuals. Because of this, we consider the system in the United States to be a mix of public and private elements. However, this also explains why there is a gap in coverage for people who do not have access to employer-sponsored coverage and who maybe do not qualify for either Medicare or Medicaid. When shopping around for insurance, some important factors to keep an eye out for are premiums, deductibles, co-payments, and co-insurance. When you have insurance, you will have access to a list of medical professionals who are considered to be in-network for you to visit in the event that you require medical attention. There are insurance plans that will only let you see doctors who are part of their network, while others will let you see doctors who are not part of their network, usually for a large cost. However, there are many instances in which you may use your in-network providers and still incur a fee. This cost may be in the form of a copay, the amount that is owed after your insurer paid its share, or they may simply not cover the therapy that you required or desired. In spite of the fact that it spends substantially more on healthcare than any other industrialized country, the United States ranks near the bottom in virtually every category. This is an important fact to keep in mind. This is not a system that is broken, but rather one that was constructed with faults that already existed. The Affordable Care Act, ACA, is a healthcare reform law. In 2010, the Patient Protection and Affordable Care Act, also known as Obamacare, was signed into law. Because insurance companies are for-profit businesses, many Americans have gone without coverage because they couldn't afford it, didn't want it, or were turned down because of pre-existing conditions. With the Patient Protection and Affordable Care Act, the Obama administration attempted to solve some of these difficulties. The following are some of the law's most important provisions. Insurance companies are not permitted to withhold coverage due to pre-existing conditions. Minimum health insurance policy guidelines have been set. Medicaid eligibility has been widened. Medicare has undergone adjustments aimed at improving its efficiency. Individuals who do not have health insurance through their employers are obligated to acquire it. Health exchanges were created to provide customers with a simple way to locate affordable health insurance and to provide subsidies to those who qualify. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.